Welcome to The Explainer. Today, we're breaking down a condition you see pretty much every single day in your practice, osteoarthritis. We're going to build a clear framework for how you can assess, counsel, and manage it, all based on the latest evidence.
So let's just start with the scale of this thing. An estimated 14% of Canadians are affected by osteoarthritis. That makes it the most common type of arthritis by a long shot. This isn't some minor issue. It's a massive public health concern, and you are right there on the front lines.
Okay, here's our game plan. To get you totally prepped for your next patient conversation, we're going to walk through these 5 key areas. We'll start with the basics of the disease and move all the way through to how you manage it in your day-to-day practice. All right, let's dive right in. Look, to manage OA well, we've got to start with how we understand the disease today. Because, it's actually changed quite a bit over the years. It's so important to get this. OA isn't just a simple problem with a joint. No, it's a progressive disease that affects the entire joint structure. We're talking cartilage, bone, ligaments, the whole shebang. It's really a systemic disorder that just happens to show up in the joint. And this really highlights a huge shift in how we think about it. We've moved way past that old idea of just wear and tear. The modern view is that OA is really a failure of the body's own repair crew to keep up with all the damage happening in the joint. Now, when you look at these risk factors, you can see a massive opportunity for us to empower our patients. Sure, we can't change things like age or family history, but obesity and muscle weakness, those are modifiable. They are powerful counseling points.
Okay, so keeping that in mind, let's see how this shapes how we assess our patients and figure out what our goals should be. What are we really trying to do here?
What's so important to establish with patients is that our goals are all about their symptoms. We have to be super clear with them. Current treatments are not a cure. They don't even slow the disease down. Our entire aim is to manage their pain and improve their quality of life. So, when a patient comes to you with joint pain, this little comparison is vital. Just asking about morning stiffness, is it less than 30 minutes or more than an hour? That can be a huge clue. Spotting the difference means we can make sure those patients who might have RA get to a doctor, and fast. Now, before we even think about medications, we have to talk about the foundation. I mean it. Any good OA plan is built on non-pharmacologic therapy. We have got to drive this message home with our patients. Lifestyle changes are not optional add-ons. They're not nice to have. They are core, evidence-based treatments that we should be starting right away. As you're counseling patients, you can highlight that active things, like strength training and aerobic exercise, have really strong evidence behind them. And get this, even a small weight loss, just 5%, can make a huge difference in how they feel and function. A referral to a physiotherapist can be an absolutely invaluable part of their care. Okay, now it's time to climb the pharmacologic ladder. And the key here, the absolute key, is taking it one step at a time. We're always weighing the risk versus the benefit for that specific patient at every single step. This whole stepwise approach just helps us manage symptoms logically, right? We start with the options that are generally safer, and we only escalate if we really need to, based on how the patient is doing and what their risks are.
Now, acetaminophen, it's still the first drug of choice in most guidelines, mainly because it's so safe. But, and this is a big but, recent analyses show its effect on OA pain is pretty small. So it's essential to set realistic expectations. Tell them to give it a fair shot at the max dose for a week or 2 to see if it works for them.
For OA that's just in 1 or 2 spots, like the knee or the hand, topical NSAIDs are an excellent option. I mean, the number needed to treat is actually quite good, especially at the beginning. And for your patients over 75, the guidelines are clear. Start with a topical, not an oral NSAID. You get similar pain relief with way better safety.
All right, moving up to an oral NSAID. This is a major step. It's a big jump up in risk. Yeah, it might give better pain relief, but the potential for serious side effects means you have to do a really thorough risk assessment before you even start.
Before you dispense any oral NSAID, this is your mental checklist. Does the patient have a history of heart disease? Are they over 65? Are they taking other meds that could hurt their stomach or kidneys? Running through these questions is one of our core responsibilities.
Yes, the question you get all the time. Patients are so interested in natural health products for their joints. So what does the high-quality evidence actually say about this stuff?
This quote gives you a really clear, evidence-based answer you can share. Look, while some small studies were all over the place, the big, really well-designed trials, they just didn't show a significant benefit over a placebo. So you can acknowledge their interest, but still guide them with the best science we have. Finally, let's talk about where pharmacists provide just immense long-term value. It's not just about that first prescription, right? It's about the ongoing monitoring, keeping patients safe, and empowering them through education.
This table is basically your practical guide for follow-up. For a patient starting an NSAID, checking their blood pressure within a week is absolutely critical. For your high-risk patients, you got to monitor that renal function. This kind of proactive work is how we make sure these drugs are safe and effective.
You know, proactive counseling really does improve outcomes. Always, always reinforce the exercise and weight loss stuff. And that last tip? It's gold. Advising patients to take their pain reliever about an hour before they do activities that they know will cause pain, that's a simple piece of advice can make a world of difference.
And this really brings us to the ultimate question, doesn't it? OA is a chronic condition, a long journey. So effective management isn't just about handing over a product. It's about becoming a real partner in your patient's care. So, how will you change your next conversation to really partner with them and improve their quality of life?